Hello, I'm Jawad. I'm Exec Medical Director at East Lancs. This is my update on the 22nd of July 2021. I'll start with the numbers of people who are positive with COVID in the community. So in Blackburn with Darwin, we have a total of 431 per 100,000. Burnley 624, Hyndburn 471, Pendle 422, Ribble Valley 414, Rossendale 588 per 100,000. And for the total conurbation, the number comes to 486 per 100,000. This is again far too high than the national numbers, meaning that there is still a lot of community transmission that is ongoing, and that unfortunately results in attendances to the hospital, and some of these get converted into admissions. Not only admissions to the general and acute beds, but into critical care. So as of today, we have a total of 48 patients who are positive with COVID in hospital, and of those 48 patients, 12 are in critical care. And majority of these patients in critical care are ventilated, means that they are on ventilation to help support manage the disease. This emphasizes the need for us to still continue with great caution of how we interact with each other, and the need to follow the principles of social distancing, masks and hand hygiene. Now, I'm very conscious that national restrictions have been taken down as from the 19th of July. But what we are seeing out there in the community doesn't give us any confidence that if we do not follow the principles of infection prevention and control, then there will be another wave of COVID. And in fact, we have never been out of this surge of COVID cases and admissions, at least in Lancs and South Cumbria. So in keeping with these, hospital is adhering to restrictions on visiting. Although we have opened up for visitors, but we have got allocated number of slots per patient, the timing, and there are certain principles that we want the visitors to adhere with. You can look at those on our website. Hospital visiting restrictions hence still remains, and the policy of masks and social distancing and all that is continue to be practiced within our premises. A&E attendances unfortunately are still very high, and I think it would be very reasonable to say that the system is being overwhelmed now due to the number. On an average, we are seeing 700 attendances within our area. That is too high a number to which the system can cope. Credit to colleagues who are working on the front line, they are, but it is coming to a breaking point. Hence, I think it is very important that alternative ways of accessing healthcare is looked at in the community. I've mentioned about 111, GP surgeries are offering extra appointment, pharmacies, and all those measures are there for people to seek advice, and if appropriate, they will be directed to attend hospital. We are also seeing an increased number of children attending hospital. Part of it is due to this virus called RSV, respiratory syncytial virus. You may have seen in the government news that this virus can potentially cause an increased pressure on the system, and we have started to see that. Preparations are in place to manage a high number of children who may